Medicare for All has been back in the news recently. A lot of that due to last weekend's Jimmy Dore versus AOC talk. Everybody's back on the Medicare for All. We're in the middle of a pandemic. We should be talking about universal health care. But even before any of that happened, a little noticed study came out of the Congressional Budget Office, a government entity. And the CBO found that a Medicare for All plan for the United States, universal health care, everybody's covered, everything is covered, would actually be about $650 billion cheaper than what we had previously thought. So even though the previously laid out plans and financial details of it showed that it would save us money in the long run, we now find out in a story that for some reason wasn't really publicized that, our bad, it actually saves you even more money. Saves us $650 billion per year. At this point, there is literally no excuse to not do this, other than the money flowing from the drug companies, the hospital corporations, and other medical field groups to politicians. That's literally the only thing holding us back. That is it. That is what is holding us back, because if you're talking about, well, it's going to cost too much. Bull. It saves us money. Study after study after study, including the ones done by the people trying to say Medicare for All doesn't work, has shown us that it saves money. It reduces administrative costs. And that's one of the biggest ways it saves us money. Because a lot of the people who look at universal health care and say it costs too much, here's what they do. They do it deceptively. They don't look at the plans and the proposals and how they would reduce the overall costs. As in we're getting rid of administrative costs. We're getting rid of, the third-party costs in here and all this shuffle. No, they look at what the system costs now and then say, see, this is how much it costs, and we just don't have that. Well, it wouldn't cost that much. It would cost this much, because we're getting rid of a lot of the fluff over here and bringing it all down to here. And yeah, we can afford this. We just are choosing as a country not to. Think about this. Joe Biden, in the middle of a pandemic, won a primary in which he said, I will veto Medicare for All if it passes both houses of Congress and comes to my desk as president. I'll veto it. In the middle of a pandemic, he said that. And he still won that primary. Then went on to win the presidential election. And that was at a time, the primary was, when 90% of the Democratic Party said we support Medicare for All. But then you had the media, you had Biden himself, you had the establishment Democrats crapping on the idea of Medicare for All, and support began to drop, and suddenly more Democrats actually supported expanding the Affordable Care Act than a Medicare for All proposal. A lot of people miss that poll. I see that a lot, unfortunately. A lot of people I respect and like on Twitter saying it's 90% support among the Democratic Party. No, it's not anymore. Go look at the polls from October. Stop looking at the ones from March and April. Look at the ones from October, the recent ones. We're back to square one on this. But this study, this CBO study, Matt Brennig has pushed it out tremendously. He's one of the few people out there talking about it. This is starting over from ground zero, and this is where we need to be. This study is something we need to talk about, something we need to spread, something we have to use to get more people back on our side to fight the misinformation coming from all directions at this point. Because we're getting disinformation from the right, from the left, obviously not the people more left of us, the center left, from the industry, from everybody. But they lie and the numbers don't. Medicare for All, universal health care saves us money. And there is no other way to say that. We save money. I don't understand how this is not already policy, again, other than the massive influence that the medical industry has over our politicians. They'd rather let us die than save a couple bucks as a country.